Most of us take medicines almost every day for pain, for fever, for acidity, for blood pressure, for allergies. But here's the shocking truth. Some commonly used medicines, when taken wrongly or in high doses, can silently increase your risk of a heart attack. No, I'm not here to scare you. And no, you don't need to throw away your medicines. Today, I'll tell you which medicines can affect your heart, how much is too much, and how to use them safely. So stay with me, because what you hear today could literally protect your heart. Medicines don't just act on the disease, they act on your whole body. Your heart, blood vessels, blood pressure, cholesterol, even your fluid balance are influenced by chemicals inside medicines. When these chemicals are used incorrectly, frequently, without prescription, or at higher doses, they can become risky, especially in people who already have high blood pressure, diabetes, high cholesterol, obesity, smoking habits, family history of heart disease. So remember, medicines are powerful tools, safe when used correctly, dangerous when misused. Let's start with the most common culprit, painkillers like diclofenac, ibuprofen, naproxen, mefenamic acid, and others. These drugs are called NSAIDs. How they can affect the heart? They increase blood pressure. They cause fluid retention. They may disturb blood vessel lining. Long-term overuse increases clotting tendency. Who is at risk the most? People who already have hypertension, diabetes, kidney issues, heart disease. What is too much? Using NSAIDs daily for weeks. Taking high doses like diclofenac 75 to 100 milligrams frequently. Combining multiple painkillers. Taking them without a doctor's advice. Remember, occasional use is safe. Habitual use is not. For chronic pain, always ask for safer alternatives like paracetamol or doctor-guided therapy. Medicines like prednisolone, dexamethasone, methylprednisolone are extremely effective, but also extremely powerful. How steroids increase heart attack risk? They raise blood pressure, increase blood sugar. Increase cholesterol and triglycerides, cause weight gain, cause fluid retention. Short courses for emergencies are safe. The problem is repeated, long-term or self-prescribed steroids, often taken for allergies, asthma, skin issues, or joint pain. Steroids must always be used in tapered doses and never stopped suddenly. Next are medicines found in almost every home: cold, flu, and sinus medicines. Ingredients like pseudoephedrine, phenylephrine. These can constrict blood vessels, raising blood pressure and heart rate. Who should avoid them? Heart patients, hypertensive patients, people taking BP medicines, elderly patients. Even energy drinks or instant relief syrups may contain these ingredients. Section 5. Diabetes and BP medicines. Misuse can be dangerous. This part is important. Medicines for diabetes and blood pressure do not cause heart attacks, but wrong doses, skipping medicines, or stopping them suddenly does increase your risk. Stopping BP medicines can cause a dangerous rebound increase in blood pressure. Irregular diabetes medicines cause sudden sugar spikes, damaging vessels. Overusing certain BP medicines, like beta blockers, without monitoring can cause excessive slowing of the heart. So the risk is not from the medicine. The risk is from using them incorrectly. Section 6. Antacids and acid-reducing medicines, 5:20 to 6 o'clock. Long-term use of strong acid reducers like omeprazole, esomeprazole, pantoprazole is common. They don't directly cause heart attacks, but chronic use without need reduces magnesium levels, can affect heart rhythm. Interferes with the effect of other heart medicines, so they should be used for specific conditions, not as a daily habit. Section 7. How to use medicine safely. Most important part. Here is the heart-protecting checklist you must follow. Never use painkillers for more than 3 to 5 days without doctor advice. Avoid multiple painkillers together. If you have BP, diabetes, or heart disease, consult before using NSAIDs or cold medicines. Do not take steroids without a valid prescription. Never stop BP or diabetes medicines suddenly. Always tell your doctor about all medicines you are taking. Check your blood pressure and sugar regularly if you're on long-term medication. And most importantly, self-medication may give you temporary relief, but can cause long-term harm. Closing. Medicines save lives, but only when used wisely. If you learned something new today, hit like, share this video with your family, and subscribe for more clear, science-based health information. Stay safe, stay informed, and take care of your heart. If you like this video, please share and subscribe. PharmaNerds-Health.